inertia. That's the training systems, the way we've always done it and things of that nature, and the necessity of getting a certain amount of work output done in a certain amount of time that doesn't leave a lot of room for quote unquote well-being and leads to the indoctrination. And if we don't feel good about who we are, we don't feel good about ourselves, it's hard to show up for our patients. And as Corey
Right.
pointed out, there's a certain amount of building the foundation. It seems as if medicine right now, we spend so much time just stomping out fires. Whereas if we could just take a step back, build a foundation and create a relationship that would have higher buy-in from our patients and a higher, the word they use is compliance, but I would say we're on the same team with the same mission so that we could have better outcomes with ultimately less time spent because we're not just stomping out fires.
Right.
Hmm.
Yeah. Yeah. Sasha, you had mentioned, positive organizations, building positive organizations as part of, applied positive psychology. I would imagine
Hmm.
is how do you build positive organizations? What does that look like? Tell us about that.
I mean, it's, not certainly not the area that I have spent, sort of
Sure.
post grad that I spend my time focusing on. But I mean, I think fundamentally it's, you just have to have buy-in, right? There has to be
Yeah.
a top down sort of leadership around, here are the values that we care, that, this is our approach. These are our values. This is what matters. But I think, in so many, I mean, I'm just reading this fascinating book right now called Careless People about Facebook. And it's such a great example of, you can have these sort of lofty values on paper, but then what is happening in practice? In practice, are you aligning with those values? Do you care? Do you actually uphold those values? Are you
Right.
are you you know is that, because I think it's easy, especially with this sort of thing, to say, like, oh yes, no, we care so much about, the, the mental health of our, physicians and nurses and also our patients and et cetera. But then at the end of the
Yeah.
day, it's like, well, wait a minute, did you get this done? As you said, like, is this
Yeah.
efficient? Is this getting done? Did you get, like,
Right.
you're not being applauded for spending the extra time with the patient to make that person feel comfortable or give that person the confidence that
Right.
they're going to recover, or whatever it is. I mean,
Yeah.
um, that those human interactions, they take time.
Yeah.
They're
We,
not
we
efficient. Like,
no.
that's the whole point of it.
Hmm.
Human interactions, to have some quality to it, are not measured by efficiency.